5 common mistakes doctors, NPs, and PAs make when treating heart disease. Now, this is most often associated with lack of experience. Number 1, they place patients on difficult regimens, prescription drugs, especially the elderly, like 1.5 tablets twice daily, instead of one long-acting pill, making life far more difficult and markedly reducing compliance, especially in the elderly again. And number 2, they forget to stop one of the blood thinners a year after someone had a stent. In some cases, even it can be stopped in 6 months. And I see this pretty often. You know, the patient's discharged to the regular doctor and doing well and comes to see me years after the stent on both antiplatelet drugs. Number 3, they treat the cholesterol hypertension, but not to the right levels. For example, they treat blood pressure, but again, not down to current guideline levels, which for most is as close to 120/80 as possible. The elderly, especially with risk of falls, are an exception. And number 4, they place patients on medications, but don't have a serious discussion about diet and exercise. That's right. Trials show that patients who adhere to a good Mediterranean diet, exercise, do far better than folks who are just placed on meds. Many docs or others just don't have the time. And number 5, they place patients, oh boy, on huge doses of these potassium horse pills, more pills and not easy to swallow, instead of advancing the heart failure medications that save lives, which also increase potassium, like aldactone, ACE inhibitors, ARBs, and ARNIs, or just adjust the water pill, maybe it's too high, or even increase the potassium in their diet. I see a lot of patients each year, a lot, and you know how many patients I have on potassium? 0. There's a reason. I look at the patient, and I find ways not to put them on it and advance the good stuff, not the potassium.